Hi, in this video I'll be talking about breathing problems in people undergoing treatment for cancer, what causes it, and how it can be managed. So breathing problems range everywhere from problems with wheezing or shortness of breath or tightness in the chest. So there are quite a few things that we think about with breathing problems. I guess another one would be you take a deep breath in and it hurts. So I'll cover all of those. The first thing I'd like to say is if somebody has been treated with curative intent, they've had surgery for their breast cancer, it's unlikely that breathing problems are related to the cancer itself. If somebody has advanced breast cancer, we want to make sure that the breathing problems are not related to the cancer. For example, if there's fluid around the lung, that can make it hard to breathe because the lung is squished or compressed. If there's that the fluid around the lungs can also make it hurt when you take a deep breath in, so you kind of have a catch. When you breathe in, it hurts. That's called a pleural catch. And there are other things that can happen when you have advanced disease. Let's go to treatment. What kinds of treatments can cause breathing problems? Well, if you are having a reaction to your chemotherapy, which I'll start with, when you're in the treatment center, you might notice you're having breathing problems. The thing is, when you're getting chemotherapy in a treatment center, you're being monitored very closely, and these things, reactions tend to arise when you're getting your first treatment or your second treatment, and your nurse giving you the chemotherapy will stop the chemotherapy, give you other medications, check your blood pressure. It can be quite dramatic. Lots of people come around and they take an EKG, but this is just standard practice for monitoring somebody who's having breathing problems during treatment. That can be with chemotherapy or with targeted therapy. We have other videos about targeted therapy as well as a blog post. The other thing that can cause breathing problems would be a more long-term reaction to chemotherapy. There are some drugs that can cause pulmonary or lung toxicity. This tends to happen over a few cycles, and we'll see this with drugs like cyclophosphamide. It's quite uncommon. I have to say I've probably seen this 10 times in treating thousands of people, but of course we want to make sure that our treatment isn't causing more harm than good. So again, pretty uncommon with chemotherapy itself, but something you should know is a possible side effect. And you'll be told about this before you start chemotherapy. You'll get a whole list of possible side effects. Other breathing problems with chemotherapy can occur because you're anemic. So over time, with more and more chemotherapy, the red blood cells made by the bone marrow can go down, and that's called anemia. And people with anemia notice they have breathing problems, especially with exertion. So if you're walking or going upstairs, that's a big tip-off. If you find you're short of breath going upstairs, you'll want to talk with your medical team, and when you have your complete blood count checked, they may notice that you're anemic, and there are things we can do to treat anemia. We try not to give transfusions unless somebody's having symptoms, but if you're having symptoms, getting a transfusion will help you feel much better. And we have certain thresholds for which we would recommend a transfusion. If you're having symptoms, that's one of the things that we'll use to decide whether or not you need a transfusion. We're going to make another video about blood transfusions, their safety, and what to know about blood transfusions if you have cancer and are getting treated. The other thing to know about if you have cancer is that pulmonary embolism, which is a blood clot that goes to the lung, can cause shortness of breath. What you'll be told is to look out for sudden shortness of breath. And actually, it doesn't need to be sudden. First of all, you can have one blood clot go to the lung, and then you can have several others. And so you could see how the shortness of breath could get worse over time. And it's really important that you let your medical team know if you're having shortness of breath that you haven't had before. If you have a history of blood clots, you may actually be offered prophylactic or preventative blood thinners. So that might be something your medical team will talk about. So it's really important to let them know if you have a history of blood clots in the past, for example, during pregnancy or when you're on birth control pills. So chemotherapy can cause breathing problems like shortness of breath, and cancer itself can cause pain from, sort of that pleural catch I was describing. We can also see that pleural catch with a blood clot. So I hope this has been helpful in terms of chemotherapy and breathing problems. Targeted therapy breathing problems, as I mentioned, you can have a reaction. You can also have a more long-term reaction. It's not that common, but we do see that quite rarely where people are on targeted therapy. Usually that continues beyond chemotherapy, and you can have a pulmonary reaction to some of our medications. It's a pneumonitis or inflammation of the lungs. Pneumo refers to the lung and itis refers to inflammation. So these are the kinds of things, again, to let your medical team know about. Radiation therapy can cause shortness of breath, but only if you're getting radiation to the lung area. So that's the chest area. And we're very precise now with the radiation planning so that we really radiate minimal parts of the lung. Nonetheless, you can see early inflammation of the lung soon after finishing radiation usually, or you can have more long-term problems down the road. Radiation therapy tends to cause early on inflammation, so that's itis, so pneumonitis, and further down the road, more of a scarring or sclerosis, so it can be sclerosis of the lung. Again, that's really uncommon with current day treatment planning, where we use three-dimensional planning and try to limit any exposure to the lung. Nonetheless, it can happen, and that's something you'll be told about before you start radiation therapy. Now, endocrine therapy or hormonal therapy can also cause breathing problems. People on tamoxifen are at a slight increase in the risk of blood clots, and I described what that was before with chemotherapy, but just as a reminder, you can have sudden onset shortness of breath or more gradual shortness of breath, and you'll want to let your medical team know about that if you're on tamoxifen. The other thing to look for would be asymmetric swelling in your lower legs or in your thigh, or sometimes if there's a very large clot, it can cause swelling of both legs, and that can increase your risk of a blood clot going to the lung. And what do you think I'm going to tell you? Yes, talk to your medical team. These are the kinds of things you don't have to wait till your next appointment in 2 or 3 months. This warrants a call to the medical team. And if you're suddenly short of breath, this warrants a call to the doctor on call at night, or the nurse practitioner or physician assistant on call at night. Hormonal therapy, such as the aromatase inhibitors, can rarely cause shortness of breath. It's so uncommon that a lot of doctors don't know about it, but we can see shortness of breath that's reversible with the aromatase inhibitors. So I've seen this in a few patients. It's important to know about it because you'll want to be switched from one aromatase inhibitor to another, or perhaps to tamoxifen. It's an interesting thing with the aromatase inhibitors, or AIs, is that even though they work the same way, their side effect profile can be a little different. So if you can't tolerate the first one, you can go on the second one. Rarely do we see people switching to a third, and usually if you don't tolerate the first two, you won't tolerate the third, but it's amazing how many people will tolerate that second one. One thing we often do is do a washout period where we'll have you come off the aromatase inhibitor, see how you feel before we start the second one again. I've covered a lot in this video. If you want to know whether chemotherapy, targeted therapy, radiation therapy, and endocrine therapy might be part of your treatment plan, go to yerba.com to see your personalized report. And if this video has been helpful and you like it, click like and subscribe. What this does is it helps us provide this information to other people going through the same thing.